Good morning, everyone. It is nice to have you this morning and come together to discuss a very important topic, important part of our body that we seem to have a lot of struggles about. We are talking low back pain this morning, which is a big word, noting that since I hope I am not muted. Please confirm, host, that I'm coming.
Yes, we can hear you clearly.
Okay, great. So we're talking about back pain, and if all of us, if we remember, even when we were little, we used to see our parents struggle with back issues. Sometimes they would tell us, our grandparents would tell us to step on their backs, and because they are hurting, or they would say, the way my back is feeling, it feels like it's going to rain today. So back issues have always been there. Different generations have suffered in different methods. It depends on what they're doing. But today we are going to just talk about back pain. And we know from a lot of research that has been done all over the world that at one time, about 70% of all of us at one time will have back pain, which means not all 75 of us actually will become disabled from it, just a few people. But it is a recurring problem that we usually go through. So let's talk about back pain. And with me is Mr. Thuo Kirambi, who is one of our physiotherapists in Machakos, and he will join me towards the end so that we can go through this. So we're divided into two. There is acute back pain. Acute meaning it just happened, it's less than 4 weeks. And a lot of people sometimes will try to treat themselves at this time. And you will see people at the pharmacy saying, I need the strongest medication you can have because my back is hurting. Or some actually start getting depressed because they're thinking, this is the end of me because my back is so painful. But we know that back problems actually do resolve. Majority of them resolve, and then a few of them go into chronic state where it's now having pain for many months. It's 3 months and you're still having back pain. And sometimes the initial cause of the back pain is not even the one that is making you now have to have pain, which we call chronic. So in both stages, there are some interventions that are required, meaning there are different types of treatments that are required. Last time when we talked about back pain that could be caused by fracture, when it is a fracture, then the interventions are supposed to be very quickly because it's not something that is going to just resolve on its own without stabilization. But let's start on this. If I speak in, because I understand that the majority of the people on the Zoom line are just clients, patients in the population, a few professionals. So allow us to speak to patients and explain this to our clients. Some of the words that come out many times about back pain is, I have sciatica. And you'll hear people saying, I have sciatica and it's going all the way to my shoulder. But it is actually a word that is misused. But what happens is, if I can put this in real terms, our nerves come from different areas of our spine, if you can see from this picture here. So every section, every region will contribute a nerve that will come out. And as they go down, it looks like one band. Is if you look at the tail of maybe a cow or a donkey, it has many strings to it, and then it becomes one thing like a band. So even the area that has one band, like here on the sciatic nerve, inside it is many thin fiber structures, like really strings, like many tiny little strings that form together to form a big nerve. So sciatica is when you have pain that actually comes down your leg below the knee. You feel the pain in the back, it goes through your buttock all the way to your knee. It may even go all the way to your foot. This is suggestive of your nerve is being impinged, is being pushed by something. The way our bodies are created in the back, we don't have a lot of free room for swelling or infection or maybe space that is reduced. Anytime you have, like, let's say you go and lift something in the wrong manner, you didn't scoop well and you lifted the load and it went into your back, meaning that you strained the muscles of your back. And the muscles, when they are strained, they tend to get spasms. Spasms is where you tighten. That tightening doesn't tighten into nothing. It tightens into sometimes a nerve. So as long as that pressure is tightening around that nerve is going to talk to you and is going to either say pain or tingling or, you know, heat or numbness, depends on the severity of that pressure. So we can have pressure from different things. It could be you have a disc that is bulging, and we've talked about discs here many times, being like something a little soft. It's like a soft sponge that is in between your spinal bones. And so when it gets squeezed, it just doesn't stay there. It gets compressed and it moves. It doesn't disappear. So it moves to a direction where your nerve is. And so if your nerve is getting a little touching to it, then it's going to talk to you. And sometimes it may be temporary. Example, if it is just your muscle that is so spastic, if we can be able to remove the cause of that spasm, then the pressure on that nerve will be less. And sometimes your doctor will put you on anti-inflammatories to reduce the swelling on the area that is affected. And then as the swelling comes down, the nerves get less pressure. So that is what we can talk about. Sciatica is not the end of life. It is resolvable. If we talk about mechanical back pain, which majority of the people, the issues is mechanical. It can be from muscles or ligaments. Let me see if I can just hide this here. Ligaments or tendon strain. If you think about how we do our work, you look around and you see somebody washing their clothes on the floor, and you look at the area that they're moving. Some people move from their back area. They don't bend all the way at the hip, they actually bend in the back. And repeated and prolonged positioning like that will end up causing problem in the back. The back is very unforgiving. The way we cultivate, if you see sometimes in some places, people use very short pangas. They mop with a towel. We carry loads on our back. And so we misuse the structure of the back, and then it depends on now what you are doing to misuse it will cause either your ligaments or your discs or your nerve to have problems. So most of the time for us as physio, when you come to us, we are trying to look at what is the cause, not just what you're feeling, which is important, but what is causing it. So we have to work backwards so that we can see what needs to be corrected or relieved. And if it is beyond what we can do, then we will send you to the doctor for more interventions. So it could be coming from the disc areas, could be what is triggering the pain. It could be your joint arthritis in the back. And arthritis just means that there is wear and tear between the areas of the bone, like the two bones. And then what happens is when that space is reduced, it's like if you squeeze your fingers together, if there was something in the middle, then you squeeze it out, and then you'll have that disc problem. And the person who suffers then is the nerve, which is what we'll now be talking to. So we can have spinal stenosis, and some of these, when patients take an MRI and the MRI writes, oh, you have a disc herniation, disc bulge, or stenosis, they look like big words. But because they don't say how much of that is bad, sometimes you panic. And it's important to take those records to your doctor so that not just the report, but the physical MRI or X-ray, because it will explain to us whether it's just something you can live with. Because many people, majority of people, like 45% of the population, if they did the MRI today, the MRI would show they have disc herniations or disc problems, but they have no symptoms. So the MRI report is not enough. The real reading, the real picture, it's what helps us to be able to tell how bad it is. Scoliosis, where there is the wrong twisting of the spine. It could be somebody was born with it. And sometimes when we are able to find this out, especially when the kids are younger, it's better to correct it so that it doesn't cause problems with your back. But this is our back. It's a very interesting architecture, which we have to take care of. So sometimes you will see this, especially, I ask you, like when you go to church, when they eventually open church, look at some of our older people. They tend to put their hand behind their back also. They won't let their hand both be down. They'll have their hand at the back. They will straighten up for just a minute, maybe have a conversation, then they'll tend to bend down. And so what it's telling you is they're trying to relieve pressure. And they have found that being forward is the most less painful position, because now they straighten up. This person in the picture here is about maybe 30 degrees forward bend. They are looking for a lot of opening of the spine. So some of the features of back pain is stooped posture forward. You can have a flattened back where you lose your inward curve in the lower part of your back. Your muscles will be rigid. You may have pain in the buttock or foot or numbness. And then this position over time, what it does, it makes this person now have tightness in the front. The hip muscles will get tight. The back muscles will get so weak from being overstretched forward, and they will not be able to hold this person up well. So we'll start now having other problems secondary from this. So low back pain without known cause, because you can have back pain and not have anything that can be seen on the X-ray or MRI. It may not be visible. And a lot of that is the majority of the back pain, where it's not your biology, your tissues, it's not so damaged to where it now shows up on the X-ray, but you do have pain. But we have other things that we need to look at that can cause pain, things like cancer, infection, or the cauda-equina syndrome. Remember what we are talking about. If anything occupies the space in your back, which, as we said, we don't have that free space for anything. Cancers is cells, so it's like somebody has injected cells in your space. So that in terms of pressure will cause back pain. Infection, it can be TB in the spine, can cause back pain. So the doctor's work is to be able to say, yes, it's back pain, but what is the cause? Okay, so other causes, fracture, which may be from a fall, or could be from compression fracture for those people who have soft bones. And it can be your disc, it can be spondylosis, can be cancer, stenosis, lifestyle, activity, the things that we do every day that we don't pay attention to, because that's what we have. Capillary passed forward. We lift our sacks of potatoes. We don't mind our body mechanics, and because we're used to it, until one time you tell the doctor, there's nothing I've done out of ordinary, but this one yesterday, this is what I did. And sometimes we think that's what happened, but it has been over time, repeated bad posture, repeated bad work. Right now we are having issues with prolonged sitting. Many people are either sitting in their house, on a chair, or on the floor, or on a motorbike, a matatu, regardless what it is, just sitting prolonged period of time. Our bodies were not made to take that kind of loading in that 90-degree position over time. So we end up having so much pressure in our low back area from just sitting and not relieving ourselves. And sometimes there's lack of exercises. I'm not talking about activities where you go to the shop and all that. We're talking about specific exercises that maintains our fitness. So when we avoid that over time, then we tend to weaken in our trunk, and then we start getting arthritis in the back. It can be infection, bone cancer, muscle strain, which is very often at work, very, very often, especially for those who are in the working environments where the things that we do actually causes us to have strains. The type of transportations, right now we're having a lot of motorbikes, and the motorbike people are not medical, where they are taking care of not to bounce you up and back and forth. Their aim is to get you to point B from A as quickly as possible. So we have a lot of bouncing, and a lot of the passengers at the back, you're left, you jump up and down. It feels like it's neat, but it actually translates into cumulative injury in the back. And so day 1, day 2, 1 month, 1 year, then you start having issues, and it's because of the mode of transportation. Then, of course, pregnancies because of the posture, also the Cauda-Eguina syndrome. Let me rush now. So some of the things, if we look at poor posture, in the middle is an example of someone in good posture. You see that alignment, but sometimes you find somebody has a flat back or, rounded forward back. When somebody, if you see somebody standing and they have a jacket and the bottom part of their jacket is lifted up, the problem is coming from the upper back of their, the top part of their back. And as it rounds, then the low back tends to compensate, and you'll get a problem. Faulty sitting, faulty lifting, the way we walk, the way we lay down, all this can actually contribute to our back problems. So it's important to, just like we know we wouldn't park our car or in a place that we know it's going to be damaged. The same thing with our bodies. We need to think about, what do I do every day that can contribute to my back hurting? Because if it is the chairs, you need to, mostly you think the chairs were not made for your size. So you need to either lift it up or depending on your height. Some people have mattresses that they have had for 20 years. The same mattress you bought in 1980s is the same one you lay on. So it's become worn out. It's, it doesn't give you good support, but you're used to it. So you wake up in the morning, you are tired, and it's your body saying something is not right. And we need to listen to that. At the end of the day, after working, if your back is saying, "Ooh, it feels bad," you got to rethink, what is it that I did during the day that I always do that needs to be changed, because there's a cost to that. So sometimes it's obesity in the stomach, just fat stomach. If you have a big stomach, and sometimes it happens during pregnancy, which is a temporal thing, thank God. But some people, it's forever. This is the status quo. Then you're going to have a forward pull, and you're going to have an increased exaggerated lordosis. Is going to give you problems in your low back. Sometimes it's the high heels that we are seeing these days. People putting on such high heels, and it throws your pelvis forward. It gives you a very exaggerated buttock, and sometimes people use those high heels to exaggerate their buttocks. But the end result is you're going to have issues with your back. This being the posture every day, then your body starts to mold into it, and the result is we are going to have issues there. So you can see from the picture on the right, where there is now that movement between the two vertebrae because of the movement forward of your stomach. So it actually makes that disc start to be narrowed at the back and gape at the front. So that's how a normal disc look like, degeneration of the disc, number 2, and over time, it can collapse, it can bulge, it can herniate. And the other one is just stenosis. You'll see stenosis. You can have stenosis, which is narrowing of that canal. The yellow here is your nerve, and you can have narrowing and not have any problems if it is not too bad. If it gives you symptoms, we need the doctor to look at it. So presentation, back pain or fatigue with minimal activity, you just do a little bit of thing and you're looking for a chair to sit down. Okay, or you have pain in the bottom fold of your buttock, or your leg has pain without any cause there, or numbness. And this numbness is like if you sit in a chair for a long time and you press on the nerve under your thigh, which is your sciatic nerve, you feel that numbness going down your leg. Then you get up and your leg feels fine again. But if now, because of back pain, it doesn't go away, then there's a problem. And sometimes you'll find, you get up in the morning and there's a lot of pain, but as you walk around, it feels better. It's not that because the day has turned from 8 o'clock to 9 o'clock. It's not the change of time. It's the movement that you have now started to create in your back that is allowing spacing, is allowing the discs at the back, the structures at the back to relax. And then the pressure is less, so the pain goes down. And so anytime we have this pain, morning pain, then we know there are issues. There are issues in the back with prolonged positioning. And so for the physio, they will instruct you on what exercises you need to do to be able to maintain spaces when you lay at night, so that you can get up in the morning and just go to do your work instead of walking around to get relief before you can start off your day. So some of the symptoms that need urgent physician attention is pain, numbness, weakness in one or both legs that causes you to stumble. You're stumbling, you feel like, I'm about to fall, or loss of sensation in your legs, buttocks, inner thighs, back of your legs, which may get worse. The area of the body where you sit, we don't like hearing that I am numb there. Recent problems with bladder and bowel control. And when you come to the physio, we always ask you, are you having issues with your control of your bladder or your bowel, which is a red flag, is a sign for something that needs attention quickly, or sexual dysfunction that came suddenly. So I won't go through this picture, but this shows why if there's a compression at the cauda equina area, then you are going to have issues with your bladder and all that. So our assessment when you come to us is very important, very important. We look at what we listen to what you say, because it leads us to the cause. And so the questions that we ask is how, when, why, how much is it, what makes it go away. Then we start to do a physical examination to see whether your history can be correlated, or whatever we are measuring is giving us the answer of the history. So we'll go through a physical examination. And so the first assessment, the first visit is always more thorough, because we actually want to know what is the problem, and then we can start to treat going forward. So when we have a guess, if I put it that way, on what we think is causing the problem, then we'll do some tests that are going to confirm that diagnosis, or remove other diagnoses that look like that one, so that we know we are actually treating a muscle spasm and not a disc problem, though the symptoms may be the same in terms of pain. So we don't treat blindly. We want to know what it is. And sometimes when we can't tell with a special test, then we reach out to the doctor, who may do his test, may want to order other more high-level tests. So some of the tests that we do, there's a reason behind us tapping on your back, or us saying bend forward. We want to see, if you bend forward, what is actually bending? Is it your low back? Is it what is compensating? Because sometimes when you have pain in the back, what will happen is your knee may want to bend so that you don't bend your back, or you may want to just go in your pelvic area or your upper back, trying to protect your low back. We want to see, are there issues with your reflexes? Is there any numbness? And if there is numbness, what nerve is it following? What pattern of the nerve is it following? So that we can now go to the back, to that area where that nerves come from, and see whether we are having a lot of stiffness there, or is it the joint very loose? Because either of them is treated differently. Okay, so the treatment focuses on particular structure instead of diagnosis. So we don't treat low back pain, but we treat the structure that is affected. If it is stiffness, we want to look at giving spaces. We want to give strength to that area that is going to prevent you from having to collapse at that segment every time. If it is mechanics of how you work or how you lift, we want to train you on the best way to do it. If it is weakness that has come about through maybe prolonged period of back pain, then we go with the back pain, but we also are going to address the weakness. And we have found that a lot of our patients with back pain also don't do a lot of other exercises because of that pain limiting them. So important for us to do not just the back, but to treat the person as a whole, so that your program is also going to include exercises that help the health of your heart. So we will do even bike exercises that will both address the movement in the back, but also the movement required to protect the health of your heart. So those are like your cardio exercises. So we find that specific treatment of problems of the spine have been proven to work best in treatment is when it is targeted. So everybody gets a different type of workout. So you don't come and say, I want kuchomwa, nilichomwa. No, that's something that majority of the people can do at home. You can buy a hot pack and do that at home. The issues is not that your back needs a lot of heat. Heat is only used if it has to relax the area so that you can be able to participate in exercise, but in itself is not a treatment. So depends on the cause, then we'll structure the treatment accordingly. So segmental stability is very important, meaning if it is, and sometimes the doctor will be saying your L1, your L2, your L3 segment is this and this. So we'll look at the stability of those areas, and we'll do exercises that actually bring stability to that, not the whole back, especially to the area that is having problems. I think I'll call upon Thuo, if he can, to just go through some physical therapy management. Mr. Thuo.
Okay, I hope you can hear me.
Yes, we can hear you too. Go ahead.
So in treatment of the lower back pain, we get these exercises are standard form of treatment, although there are other forms of treatment like electrotherapy, but mostly the exercises what focuses on getting you back to the posture that you need in order to be able to function painfully. Also, this exercise in every patient who have back pain, we always focus on strengthening those muscles, especially, and you try to do the exercises that are focusing on the back and the pelvis, and also the exercise if the pain, for instance, goes to through the sciatic nerve to the lower limb. You try to focus such that the pain doesn't affect the pain that's affecting the lower limbs. You try to make sure the pain is at the back, so that the patient is able to do activities of daily living with ease. Now, when doing these exercises, the assumption is that we don't just look at what's the condition underlying. Yes, we look at that, but you'll find patients who have pain while sitting, two different patients, but the cause of the pain is different. So you try to focus on the symptoms that every patient shows during the treatment. Now, when focusing on the lower back pain, there are things like prevention, the health promotion, where we tell the patient this is what you're supposed to do, this is how the posture is supposed, this is how you're supposed to do your activities in order to minimize the pain. Then we look at the prevention of complications that occur due to the back pain. Since you say, like what doctor has said, once you have back pain, most of the our patient will develop another problem that comes with the low back pain. In order now we focus to make sure that the treatment helps the patient to avoid more complications of the back pain. And the other prevention that we do is to give appropriate supportive and rehabilitative services to maximize the quality of life. That's the use of corsets, um, uh, uh, trying to explain the patients how to modify their posture during the work, sleeping, so that they can be able to get better. Now, our physiotherapy focuses in training the back muscles, that's the extensors, the extensor muscles, the muscles of the back. We also focus on the muscles of the abdomen, because these muscles are the one that give stability to the back. Now, physiotherapy also focuses on the biopsychosocial approach in treatment and ergonomics adjustment in work environment. This entails advising the patient on if they have a pain when they are sitting, how you explain to the patient how they can sit better. If their posture in sitting increases their pain, you want to teach them how to have their posture in the right, correct way so that there is no pain. Now, exercise programs are directed on the symptoms presenting, but just to highlight some of them. Now, this goes to where you see most of the patients will tell you they saw a friend who had a back pain, and then they came to you and they know the exercises that they are supposed to do. But now the problem comes. One patient will present with more pain with bending, while another one will present more pain with bending to the back. So we try to see this patient, every patient has their own procedure, their own exercise program, such that we focus to see that the pain, the exercise program that you're doing, they are not increasing the pain, they should reduce the pain. So some of the exercises that we advise are pelvic tilts, lumbar rotation, strengthening exercise, stretches, stability exercises for the back, manipulation and traction. This exercise goes beyond just what you say, because most of the patient will have their own program, because we are trying to avoid to increase the problem. And then we always advise, if you are cramped and you're doing the exercise and the pain increases, you should try now. We try to do away with that exercise, because the aim of the treatment is to make you have a free pain range of motion. Also, we do tense application. This is a form of treatment where it helps with the reduction of pain. It's just an electrotherapy form of treatment. Now, most of the patient with the back pain, you realize that we normally we are not able to manage our weight. Now, weight plays a very vital role in treatment of low back pain, because see, if you want to increase the muscle strength, and assuming this person is obese, you try to see that you put them in the programs where they will be able to lose weight, so that the strengthening of the exercise can work better. Now, these are just some of the examples of the positions and the muscles. Like the first diagram here shows the muscles of the back. That's what we are calling the strengthening of the extensor muscles. Now, the second picture here shows how, if you have the back pain, it's just a form position where you can feel a lot more relaxed when in that position. Now, the picture here shows the diagram of a good posture when you're using maybe a computer, for people who use computer in their work, and how to make the posture better so that they avoid the back pain. These pictures shows Dr. Catherine doing some of the showing exercise to the patient during a treatment program. Now, these are just samples of the back exercises that are recommended. The first one, I don't know whether you can see well, it's what I said, it's pelvic tilt. Then we have close arm knee pushing, that's the exercise. We call them knee to chest exercises. Then we have the curl, where you lift up your upper body and the legs and the mid and the middle. We have straight leg raising. We have extension of the back, and also let's the references of from where we got our information to make sure that the information we give you is evidence-based and have been proven to work best in treatment of the lower back pain.
Thank you so much, Mr. Thuo. Just to recap that back pain is a big word for different problems that happen in the low back area. It's just called back pain. Just saying there is pain there. Just like if somebody says I have stomach pain, it can be in your appendix, it could be in your stomach, it could be in the intestines. So we don't treat all of it the same, and it's very important for people to do the right exercises, because sometimes you find you're doing exercises that you're pushing your back backwards, and that is what is causing symptoms, or you're doing the ones going forward and it's giving symptoms. So we have to get exercises that reduce, especially pain from the leg. You'd rather have pain in the back than having pain that radiates or go down your leg. So we appreciate that you chose physio to help resolve problems or to educate the public. And for any questions, we're here to take them. And we want to appreciate Machakos Orthopaedics for inviting and allowing us to be part of their patient care. And we look forward to helping many others to be able to get productive life. Thank you.
Thank you, Dr. Catherine, and thank you, Thuo, for such a clear and concise presentation. You are not only presenting to the patients, I have also learned quite a lot. In the meantime, as I'm just mentioning one or two things that I've learned, I have seen some questions have started coming into the chat. So anybody else with questions, please type them into the chat. We'll be answering in the next short while. So one of the things that I've picked that I keep hearing some of my patients asking is nilienda mazoezi nikachomwa. Sasa unanituma mazoezi nichomwe tena? And it's good that you have clarified that when we send people for physiotherapy, that the treatment is not targeted at just back pain, it is targeted at the structure that has a problem. And it is also good that we have seen that you have emphasized a lot on exercises, that we have seen quite a big change with patients who undergo physiotherapy by exercises rather than those that just go for massage or the heat therapy or kuchomwa. It is good that you have told us that each patient is unique. So if Mrs. So-and-so alichomwa mgongo, does not mean that the next person or me, if I have back pain, hata mi naenda kuchomwa mgongo, that we are all different in how the issues that we are having in the back. So treatment is tailored at my problem, not just that all of us have back pain. And something interesting that I've learned is that when I wake up in the morning and I'm having pain in the back, it might be that this mattress I've used for the last 10 years is now tired and I need to change it. Thank you for alerting us about such simple things that we sometimes just ignore. And so we'll go into the questions. And the first question I see has been posted by Lydia, where she's saying there there is some treatment of back pain where people go and lie down on some special mattresses for an hour or more and they feel better. But I have to keep going there for it. What are these mattresses doing and is it safe? So we can start with that question, because after that, there's also a second question that she has asked, that when I am doing small laundry, I put a basin on a raised platform so that I just bend from the shoulders only. Is this bad for my spine or something? We can start by answering those questions. And while you're at it, Dr. Catherine, I will maybe ask you to make a comment on these adverts that we see in the streets, Nuga-based, Seragem. What are they? Are they helping us? Should we go for them or not? Dr. Catherine.
Thank you very much. I think in this world, we have seen that we have a lot of business ideas and businessmen. And one of the niche area that has been exploited over the years is the area of pain, because a lot of people suffer from pain. So the Nuga-based concept is, it's what we call a glorified massager, where you lay on the bed and it shakes you and shakes you and shakes you. And because you have gotten some movement and maybe you are so tight, you feel better. But because it has not cured your problem, you have to keep going there. It's actually not something that is approved by the medical field, but it is an area of exploitation that has happened. In fact, the last time when I went to a Nuga-based place for investigation, the thing that stopped me and I got a little bit upset is when the lady, because I paused like I was a client, the lady said, with this one, even breast cancer, oh, it will disappear. I said, this now you have crossed the line, where you say, because all the nerves of the body come from the back, so whatever the problem, whether it's your liver or cancer, it will disappear. It is very deceptive. So most of the clients have started looking. I get calls all the time, people who want me to buy their beds from them, and I say, I don't use those. They have no science behind them. But I think if somebody is idle and you need a place to go for vibration, it's okay to pass time. But we need to realize, if you have a knife that is pressing inside your heart, however much I shake you, the first thing I need to do is to remove that knife. So we need to be able to look at causes of problem and not falling into the marketing things that are around us. But that will stay for a while until the population is well educated. Then the placement of things on a stool. Yeah, we do encourage things that are repeated as if they are at a waist level, a little high, it's good. It keeps you from, from having to bend and to do things that are so repeated as using a long handle mop, using a long brush, those type of things that you have to do every time in your house. You want to look at how to get your posture in the right method so that you're not down on your knees, pulling on a towel for mopping. Just get a long handle mop. It will save your back. The other thing, I'm not remembering the other question.
Those were the two that she had asked, whether it was safe or not. So I had asked Nuga-based Seragem, are they the same thing?
Nuga-based and Seragem, it's the same thing.
Mm.
Yeah, it's the same thing. It's a bed that has a heat. It has a heat to it and has a vibrator. So the combination is very. They have those type of chairs in the airports where before you go to the next flight, you sit on a chair that gives you a massage. Massage is not an evil thing. They are not bad. If you are in such much pain that you can't move and nobody can touch you much, then I guess it can help you to relieve the pain, but it will not resolve the cause of the pain. And the same thing with heating pads. They are good, but we use them as a preparation for you to be able to exercise. What they found many years ago is if you put a person in bed rest because of back pain, the disc actually starts to degenerate. So movement is supposed to be introduced early We introduce function early. So if you're having back problems, we don't aim for bed rest unless you have a fracture or something that bad. But mostly is introduction of movement early, introduction of physical activity, so that you don't sit down and remove yourself from life, because then you start having, the back gets worse, then you start having issues with your blood pressure and your sugars control because of lack of activity. Yeah.
Thank you. Then Zara Sheikh is asking about the exercises. When does one do back flexion exercises and when does one do extension exercises?
We choose the pattern of movement depending. She's asking that because she's a physical therapist and she wants me to tell the other people because she knows. We want to centralize, as Thuo said. Centralization means if you have pain that is going from your back going to your leg, you want to do the exercise that brings the pain away from the leg, and the only place you have is in the back. So when you are doing your assessment, you attempt to see what position centralizes the pain. What position causes the least amount of pressure in the back so that the pain is less now going down your leg. Because as long as the pain is going down your leg, it's giving us a sign, I am under pressure. So if a patient comes, for example, if a patient comes, they have spinal stenosis, before you strengthen the extensors, because you eventually want to strengthen the extensors, you want to do some exercise in flexion, reduce that pain that is going down the leg. Once it is reduced, then the progress to it is where you now strengthen the whole back, and it will be both flexion and extension, because you still need the extensors. But in the first stage where you're trying to reduce the pain, you want to see, is it the flexion bias or is it the extension? Whichever gives you the pain away from the leg, meaning centralization, is the position the exercises you start with.
Okay, thank you. So once again, it seemed to be emphasizing that the patients are different, so each of them is getting their specific treatment. Dr. Speciosa has met with many patients with very many different questions about the back, and she's asking some of these questions. How do I exercise when I can't even walk? I guess because of the pain. How does TENS work? Another one asks, I am obese and I have back pain. I can't do exercise because of the pain, and yet I'm being told to exercise to lose weight. How do we handle these questions?
I think we want to demyth the word exercise. Because sometimes when we think about exercise, we focus on the area of pain and we forget that we are whole body. So when it comes to the area of weight loss, now remember, the way you lose your fat cells is if you go through at least 10 minutes of moderate exercise, not a few 2 seconds of low level, is 10 minutes and above. 30 is what is recommended. So you think of, what do I have that works for me? If I have back pain, I can do bike exercises. I can sit on a static bicycle and be there for 30 minutes. I can use the arm bike. 30 minutes is not going to hurt you. I can start to do even some sitting exercises, because what happens is if you take your body through work, it doesn't say, because you did not use your shoulder, you only used your legs, I'm not going to lose weight. No, the whole body contributes into the energy expedition. So we usually look to see what is the position that causes the least amount of pain that can allow prolonged position. So most of the back pain patients that come to our clinic, you will find we tend to put them on the static bicycle because their back will be stable, yet they'll be able to participate for a prolonged period of time. Then we can be able to lose some calories through that work. And it is the accumulation of the loss of calories that ends up having the shrinkage or the usage of the fat cells. So if we are only doing 2 minutes here, 2 minutes there, that doesn't raise your heart rate, is not enough. It's not enough to make you lose weight. It takes quite some effort, but the component for weight loss is time. moderate amount of exercises, and then the time. So that, so if you're pregnant, somebody says they can't walk. So there's a reason why they can't walk. Is it because of their knees? Is it because of their back? If it is only the back, then we can exercise through the legs. There are positions for being able to put weight on your legs and working out. Your arms are still intact. Most people who have, if it is pregnancy that is keeping somebody from walking, they can use, if it is you know, the SI, the sacroiliac joint that is compressed, there's a little belt that people use to allow you to have less pain there, but we actually recommend walking. And by the way, walking is the first line of good cardio exercise. Walking is recommended for at least 150 minutes per week at moderate, meaning you're not just walking like slowly, you're walking brisk. That will protect your heart. It will protect you. It is good for the back discs because the movement that happens as you walk helps to take food, nutrients into those discs that don't have a direct blood supply to them.
Thank you. Zara is asking again, topical gels, these drugs that we are given to apply on the back, the diclofenacs, the Fastum gels and the like, such as deep heat, do they really help with pain reduction?
They help to a certain point. It's, you know, they penetrate the skin. They cause relaxation. You know, they are anti-inflammatory in nature. So if you have inflammation and then there's swelling as the body is trying to fight whatever is fighting, those anti-inflammatory gels, they help with the pain. They don't help with reversing the cause of the pain. And that's why we have to dig deep to say, if somebody has knee pain from arthritis and they put diclofenac, they'll feel better. But if they still have wear and tear and they have weak, you know, muscles in their leg, they're still going to wear that knee more when they walk if they have a lot of obesity and all that. So yes, you'll have some relief of pain. And sometimes you want to relieve pain to keep somebody from going crazy with pain just hitting onto their brain. So that 2 hours where you feel you can breathe out is sometimes enough. But then you look at what can give me prolonged relief. And that's where physios come in.
Okay. Then George is asking something relating to what you had mentioned. When should an expectant woman expect low back pains? I'm assuming that is when in the pregnancy should they expect the back pain? And then how do we manage it? And if you're going to use medications, which ones are safe in pregnancy? The second question is, what are the right sitting and sleeping positions to avoid back pain? Something that you had mentioned earlier, maybe you will just show the slide. And then finally, how do you manage painful buttocks? That is severe pain emanating from skeletal muscles somehow.
Okay, now when it comes to pregnancy, remember we all gain weight differently with pregnancy, all of us. There are those, I'll give you an example. I have 3 kids and only one I had back pain, but in that one, you know, it was my first one and everybody around me was dictating what I eat. So I was given a lot of food, eat this, eat this, eat this, eat this. So I was a very big woman. But with that came from my stomach, belly, so my back was hurting and it started early. So sometimes if a pregnant woman gains weight well, where they're not actually going to the obesity, some don't have pain. So you won't have somebody with back pain at 3 months because structurally, your alignment of the back is still there. So I can't say it is at 8 months. It's only because of the time when most of the size of the baby are the biggest is usually the 8th, 9th month, where that's the maximum amount of displacement in terms of alignment that you find. And some women will not even have it. So there's I can't really give a clear cut on when, but we do recommend, for those who have, if you're pregnant and you're on high heels, we'd say put a wedge instead of high heel, put a wedge, so that now you don't even make it worse. Wedge meaning the shoe is high, but it is flat at the bottom. So there's the toes and the heel are on the same level. And that's usually what we tell people. Let your heel and your toe, if anything, might be 1 inch, but not beyond that. Like what the gentlemen do all the time. Then sleeping positions, if it is laying on your back, I find people when they lay on the stomach, if you lay on your stomach, you increase the in of your back, and that over time will cause you problems. When it comes to the choice of pillow, now that is an area that the science is not very clear to where what pillow makes me more comfortable. So sometimes you have to play around with either the hard one or the soft one, but your body talks back to you. It'll tell you this is not good. You wake up in the morning, your back, your neck is painful because you had a very, very, very hard pillow that did not take the contour of your neck, then you want to avoid that. But sometimes when you have back pain, if you put a pillow under your knee, because it will open your spine, it will give you some relief. So those are the things you do. Like if you go to the clinic and see a physio, the first thing, the question that is important is to say, how do you lay down at night? I lay on my back. How long do you maintain that? And somebody will say, I have to start tossing around. So, and we know how important sleep is. So we have to work in the clinic, or you can work at home to see exactly what position gives me the least amount of symptoms. Do I have to need a pillow or holding in front of my chest, on my back, a pillow between my knees? Is that the most comfortable? Is that what aligns my spine? Because we are trying to maintain those alignment. So yes, when it comes to positioning, we have to do that. Talking about drugs, I can talk drugs when the docs are online. There are some contraindications for pain medication in pregnancy, but you're thinking, what is the cause? So that if it is postural, can you teach this person to do some exercises that can work on their posture? Is it because of the seat they're using might be in the office as they're pregnant? Some people have a small pillow at the back, and then it takes them forward even more. If it is so then painful, then the doctor will have to say, okay, let's get this low dose medication that's not going to interfere. I usually will not tackle medications when I have a doctor online. But yes, if it is structural, meaning it is superficial, you can use the hot pack. Tell them to buy a little hot pack and put it at home for 30 minutes. The little water bottle at home. 30 minutes, we tell our patients not to go more than 30 minutes, because your body will now start trying to reduce that heat, because you have to have a balance, a level of heat. So beyond 30 minutes, you have gotten all your benefits for a hot pack or hot water bottle. But those are some of the things people use at home. If the pain is not well controlled, then the pregnant person can be given a TENS unit. TENS units have been used by many people to be able to function at their work areas, so that the pain is not triggering into your brain the whole time. You can block it. So you use it for about 6 to 8 hours as you need it, just to block that pain. Yeah.
Thank you for handling that one so well. Actually, I'd been sent a private message also asking the same question about pregnancy and non-pharmacological ways of dealing with it, which you have handled very well. Now, Oliver says that he does quite a bit of lifting work at his workplace. What are some of the exercises that he could do to strengthen his back? And is there anything that he could wear to give support as he lifts? And then while you're still on this slide, before you come out of it, the positions, maybe make a mention of the position for the position you should take while lifting things from the ground.
Okay, let's start with the one that says bed posture for lifting. When you look at that person, when you think physics a little bit, the only thing that will move in that body is going to be the back. The low back is the one that's going to have to straighten up so that that load comes up. So repeatedly, because our back are not made for that kind of loading, so repeatedly this person is going to have a problem. The one that says good posture is when they get up, the area that is going to be doing the work is the legs as they straighten and take that load the rest of the position. So if your work is lifting every time, I would say you'd even have, you can use a back belt, the ones for lifting. It won't completely eliminate your chance for hurting yourself, but it will give you a cue to remind you not to be stupid about lifting. We emphasize that we squat if you can, use mechanical devices if you can. So I look at lifting as, what are you lifting? Because sometimes we have people who go to lift. For example, somebody is going to pick up trash and they don't even know how much it weighs. And they start to lift without that knowledge, and then they end up hurting their back. You have to do back exercises. It's difficult for me to say which one, because it depends on who this person is. I wouldn't want to hurt you. But if you have a gym around you and tell them you want to strengthen up your back and your legs, because lifting is a component of many structures. If you don't have strength in your legs, you can't squat. If you don't have range of motion or movement in your knees, then you squat like this, then somebody has to lift you up from that position because you don't have that strength and that flexibility. So you have to work on all that. But to me, if that is somebody's line of work, then those components that are required to prepare you are important. So it's sometimes we think going to the gym, I know the gyms are closed because of COVID, but sometimes we think it's a waste of resources and time, and it actually is not. It's supposed to be food and exercise, but we do the food 3 times a day or 4 times, and we exercise once a week, and we expect, well, the rest is the doctor have to fix it, I guess. But it's important for us to think about our body as a machine that needs maintenance, daily maintenance, lubrication, training, so that whatever we do, we don't punish it. I'm trying to remember the other question. So in terms of the lifting, I think I talked about you can use a back belt. We always make sure that our stomach is tight, because our stomach muscles are what braces our low back. If you have a weak belly, then when you lift, the back is going to take that load. So even as I lift, the one word I tell myself is tighten your stomach. So I don't lift when my stomach is loosed up, because then my back is going to have to take it. So maybe one day we will have a back school class where we come in here and talk about ergonomics and lifting mechanics, and educate our public so that we don't end up having issues.
We should plan that. I think we're going to plan it among the sessions. And then there's a final question from Richard. He says that one of his patients told him that he has back pain and the doctor recommended that he stop smoking. And he's asking, how is smoking going to worsen back pain?
Well, among the top WHO strategies for health is physical activity, smoking. What's the other thing?
I don't remember them.
Yeah, there's 4 for reduction of cardiovascular diseases. Now, smoking as a variable by itself, you may not be able to draw a straight line to it, but smoking has actually been found to be very damaging to our cells. Whether it is reduction of the amount of oxygen, even following the smoking episode, where you're having a reduction of uptake of oxygen for 2 hours from a single puff. So there's no way we can glorify smoking. The only thing is, in terms of it as a cause of back pain, there may not be there may be other things that could have led to the recommendation than just the smoking. But might be that's all that somebody came up with that moment, but that cannot be a single tool for, say, if you stop smoking, of course, we know that you're going to have a lot of gains for health, but yeah, so it could have been, you need to stop, you need to start exercising, or you need to reduce your weight. You know, you need to start doing weight-bearing exercise and reduce your lipids, and you know, and increase your bone density, all that. So yeah, let that just slide by, and as a physio, just pick up on what can really give the, because if that patient goes without smoking for 6 weeks and they still have back pain because you did not treat their structural deficit, then you have a case to answer.
Yeah. We're going to stop there. I will ask that anybody who has any other questions to kindly send them to our usual number, 0733 398 390, and we'll be able to continue answering them on the WhatsApp. So just one comment before I make one or two announcements, that even when you're sending these patients for physiotherapy, we still, as now the doctors, still aim at, first of all, reducing their back pain. Then we can be able to send them for the physiotherapy, and it becomes so much easier for them when you have reduced the back pain. So some of you may remember that in the last presentation, Dr. Mwanaidi talked about injections that we usually do to the back, and some of those injections are very useful in reducing the back pain. So, two announcements, and then we will be calling it a day so that we don't sit for too long and start complaining of back pains ourselves. In our next presentation, which will be a month from now, we'll be talking about fractures, and we'll be having the presentation on the 3rd of October. By then we will know who's going to be presenting on that day. Some of us may have had very many questions concerning fractures, whether it is for them, whether it is for their relatives. Some have asked me questions about, why are you applying a cast or a plaster of Paris on this fracture when so-and-so had said you're going to do surgery? Some have asked the opposite. Why are you choosing to do surgery when so-and-so also had this fracture and they ended up with a cast? We've had those kind of questions. Some of us, we've talked about doing exercises when you're having plasters. Can you drive when you've had a plaster, when you've had a fracture? When you've had a fracture, does it mean that you're going to end up with a deformity? And there's so many different questions that people have concerning fractures. And so for this one, I will ask us to do something slightly different. Between now and the 3rd of October, send your questions to our usual number, 0733 398 390. And you're going to tabulate these questions so that we ensure that we are able to answer as many of the questions as possible, even just during the presentation, so that we're able to have a presentation that will be useful for all of you. The other announcement is you may have had, some of you may have got this poster on your WhatsApp or on your social groups, that on the 9th of September, our physiotherapy team will be conducting a free physiotherapy clinic. This is this coming Wednesday, and the focus is to address some patients who tend to be ignored in the society. Patients who have had strokes, patients who have had brain surgery and a brain injury thereafter, some patients who may have had spinal cord diseases or spinal cord injuries, and they are recovering from it. And so the physiotherapy team, Dr. Catherine and her team, will be conducting a free physiotherapy clinic at the Machakos Orthopaedic Clinic this coming Wednesday from 9 a.m. And so if you know of such a person who may benefit from this, please send them over to the clinic or give them that number so that they can call us and get more directions about this. And so that we can free you to be able to go on to your activities for the day, we thank you, all of you, for attending. Thank you for joining us for all this time and sparing time on your Saturday. We wish you a very good day, and we also wish you a very good month. Be blessed and have a good day.
Thank you.
Thank you.